Hello everyone, thank you so much for joining me today. My name is Kristi Teague and I'm a pharmacist with a passion for functional medicine and medication and supplement optimization. So today I'll be discussing a foundational supplement that can help balance hormones, magnesium. Of course, I can't get into every hormonal imbalance or else we'd be here all day, but I do intend to cover some of the most common conditions. With that being said, here are the objectives of today's presentation. We will start out by briefly reviewing hormonal imbalances and then, of course, get into our main focus where we will be exploring magnesium supplementation for hormone balancing, understanding its roles, mechanisms of action, dosing, monitoring, patient education, and hopefully just provide some actionable insights for your practice. Let's start out by quickly running through some of the basics of hormonal systems and detoxification. First, we have the endocrine system, which, as you all know, is a complex network of glands that produce and release hormones. These hormones then travel throughout the bloodstream to target cells or organs, resulting in specific responses. Influence numerous processes, everything ranging from our metabolism and blood sugar to reproduction and mood. Hormones are very sensitive though, and just small amounts of hormones can cause significant changes in the body. They are tightly regulated to maintain a strict hormone balance, which is essential for optimal health, and gut and liver play a large role in all of this being optimized. The liver is crucial for eliminating any excess hormones. Key processes influencing hormone balance include production, transport, sensitivity, and detoxification, which is going to encompass the metabolism and excretion of hormones. This process as a whole is called biotransformation and involves two phases. In phase 1, oxidation, reduction, and hydrolysis reactions produce intermediate metabolites. In phase 2, conjugation pathways make these intermediates more water-soluble and less toxic. Along the way, we can't forget that other organs like kidneys and GI tract, of course, contribute to overall detoxification by removing waste and toxins as well. This is why it's so important to drink plenty of water, eat enough fiber, and support our microbiome health when we're trying to balance our hormones. Consistent bowel movements is another really important piece to your overall hormonal health and just maintaining balance, because we want to get rid of all of that excess waste. But anyways, back to the liver for a second. It's important to note that it also plays a vital role in protecting against oxidative stress by detoxifying harmful substances and minimizing the accumulation of reactive oxygen species, ROS. Excessive ROS production can damage cells and impair hormone regulation, so this is key when we're thinking about balancing our hormones. Like the name implies, a hormone imbalance occurs when there's too much or too little of a hormone in the bloodstream, leading to significant health issues. This can be tricky to pinpoint because there are over 50 hormones in the body. The three key regulators of hormonal balance are the hypothalamic pituitary adrenal axis, HPA axis, which controls stress and cortisol levels. And then we have the hypothalamic pituitary thyroid, HPT axis, which regulates thyroid hormones, and the hypothalamic pituitary gonadal, HPG axis, which manages our sex hormones like progesterone and estrogen. All three of these axes do not work independently and certainly impact one another in helpful and harmful ways. The earlier we can identify a hormonal imbalance, the better, in order to prevent progression to more severe health issues and improve a patient's quality of life. With 80% of women experiencing symptoms, it's important to note that while common, these imbalances are not normal and should definitely be addressed. And I know we're talking about women primarily here, but men as well, addressing their symptoms should be considered as well. Of course, there's just a lot more women hormonal imbalances due to the nature of having more sex hormones, but we'll certainly talk about both throughout, but we will definitely lean more towards women in this presentation. And oftentimes, women have been dismissed in conventional healthcare settings, unfortunately, and therefore it's important as functional and integrative medicine practitioners hoping to really bridge that gap between these types of care settings that we can listen to these patients and then empower them that there is hope for their healing. And of course, each hormonal imbalance is going to have specific symptoms and causes, but from a big picture standpoint, here are some common causes of hormonal imbalances. Similar to other health conditions, these include chronic stress, poor diet, chronic illnesses, environmental toxins, it's a big one, lack of physical activity, and genetic predispositions. General symptoms of hormonal imbalances, however, can be varied and widespread, including major mood swings and irritability, trouble sleeping, increased PMS symptoms, poor digestion, irregular bowel movements, decrease in sex drive, painful periods, irregular menstrual cycles, weight gain, hot flashes, and fatigue. The list really goes on, but it's important to have thorough health intake forms and patient interviewing skills to start to pull all of this together. And of course, as a functional pharmacist, my goal is primarily to focus on optimizing the treatment component rather than the diagnostic aspect, but I just wanted to include all of this for completeness sake. The same goes for this slide as well. Here are just some of the common hormonal imbalance conditions seen in functional medicine practices, and I've grouped them into metabolic, adrenal, thyroid, and sex hormone categories. And again, this is not a comprehensive list, just giving us a baseline of some of the conditions that we will be discussing today when reviewing supplements. Typically with hormone balancing, we will see a cascade of issues. Oftentimes it starts with blood sugar dysregulation and cortisol issues as the foundation. And then if those are not addressed, then it can cascade into thyroid issues and then sex hormone issues and so on. And therefore it's really important to address the root, as we all know. Before we get into the list of supplements, just an important disclaimer that I'm sure most of you all already know, but bears repeating. Supplements are just one piece of the puzzle. We could have a whole series of presentations on balancing hormones, but of course addressing what we eat, how we manage stress, sleep quality, movement, and toxins are other key elements to address when building out a treatment plan. Especially since I'd rather eat my nutrients than take a supplement for them, right? There are a few exceptions, of course, that we will get into in a little bit when talking about these specific supplements. But when it comes to our diet, it's essential to focus on maintaining balanced blood sugar levels by consuming whole foods rich in fiber, protein, and other nutrients. This approach helps reduce inflammation, which is a key mechanism for achieving hormonal balance that you will hear several times throughout the presentation. And as far as sleep and stress management go, this is also very, very important because you cannot balance your hormones without proper sleep. We can also manage our stress and avoid HPA axis dysfunction by participating in mind-body practices such as meditation, prayer, breathing exercises, and regular physical activity, which will help to reduce inflammation and oxidative stress, which in turn promotes hormonal balance. We also want to avoid toxins and reduce our exposure to endocrine disruptor chemicals as much as possible. In the beginning stages of a patient's healing journey, this can take an immense amount of time, energy, and resources to implement, which honestly can be very overwhelming and paralyzing to patients making progress. Therefore, it's best to gradually implement and make optimizing our patients' natural detoxification pathways that I talked about earlier the number one priority. But of course, if we can offload some of that pressure it is experiencing by avoiding endocrine disruptors in our food, water, personal care products, and more, that's going to be better. So you'll obviously have to customize this and personalize it as you walk hand in hand with your patients throughout their health journey. Last but not least, we can add on supplements to support a patient's hormone balancing journey. Supplements can balance hormones by improving hormone regulation or providing symptom relief. Improving hormone regulation is targeted more at the root of the issue by providing essential nutrients that support endocrine function or providing hormone-specific supplements that target specific imbalances, such as low progesterone or high cortisol. Providing these nutrients supports the synthesis and function of hormones, enhances the activity of enzymes involved in hormone metabolism, and aids in the detoxification of hormone metabolites. Supplements that provide symptom relief are another great route to pursue because they offer a natural alternative to hormone replacement therapy, potentially reducing the risk of side effects, or for patients who simply cannot use HRT because it's contraindicated. Overall, an individualized approach, of course, is essential with personalized supplementation plans, monitoring, and adjusting dosages to achieve optimal results, which is why I recommend doing a medication reconciliation, including supplements, don't forget those, at each visit to ensure we don't just keep adding more and more supplements without reevaluating the rest of the list. And of course, that includes indications and durations of treatment. Did you know that polypharmacy is defined as greater than or equal to 5 chronic medications? And technically, that includes supplements. Therefore, it's important to consider side effects, potential interactions, and costs when recommending supplements. It's also important to note that not all prescription medications can be deprescribed or interchanged with supplements, and some medications are known to cause deficiencies. We will talk about this throughout the presentation, but just a great rule of thumb before we jump into the specifics. Okay, now that we've set the stage and laid a good foundation about hormone balancing, let's get into the fun part and talk about a key supplement that can help balance hormones. Magnesium. Every hormone imbalance is going to need a slightly different protocol, but magnesium can be used for a variety of hormonal imbalances, which is what led me to selecting it as my top pick for a foundational supplement that supports hormone balancing. Now let's get into this fan favorite supplement. Magnesium is often called the miracle mineral, and for good reason. It's involved in over 300 metabolic reactions in our body. We can think of it as a crucial coenzyme since so many reactions simply cannot happen without it. This includes processes like energy, ATP, production, glucose metabolism, DNA and protein synthesis, nerve transmission, bone strength, cardiovascular health, and other ancillary processes like activation and synthesis of vitamin D, which we are going to talk about in just a little bit. Because of this, there are multiple benefits associated with using magnesium. Many of us might not even realize we're running low on magnesium, even if we're not outright deficient. But both are concerning because low levels are associated with obesity, diabetes, cardiovascular disease, metabolic syndrome, and osteoporosis. Between the modern food supply stripping out food of nutrients, which is another reason to avoid processed foods, and some medications like certain antibiotics, PPIs, diuretics, those are all depleting our bodies of magnesium, and therefore we can end up with a deficiency fairly easily if we're not intentional, so supplementation can be incredibly beneficial. Of course, certain health conditions, particularly GI health issues, can also set patients up for deficiencies, so just something to be mindful of as well when optimizing a supplement list. Unfortunately, our bodies cannot produce magnesium on their own, so we need to get it from either our diet or supplements. Food sources include leafy greens, nuts, seeds, salmon, avocado, and even dark chocolate. There are, of course, several other food examples, so be sure to look those up or consult with a functional nutritionist. However, even with the best nutrition habits, magnesium can be tough to get in adequate amounts. When it comes to magnesium supplementation, it's important to choose the right form based on specific health needs. And there are a lot of forms. So I'm going to briefly touch on the most common ones and what they're most known for, and then I'll talk more about the best forms for supporting hormone balance as they pop up. So speaking of, the first one is one of the best forms for this, and that is magnesium glycinate. This form is excellent for improving sleep, reducing stress, anxiety, and depression, and alleviating menstrual cramps. I mean, the list goes on and on. It's highly absorbable and gentle on the stomach, making it a preferred choice for many. This is the main form we will discuss today, but we also have a few other options that may be suitable add-ons for your patients. This form is used most often when developing hormone balance protocols, and you may see it as bisglycinate as well, same thing. It's just a favorite for a reason. Like I mentioned, it's highly bioavailable and gentle on the stomach. So this really is just a win-win since many patients are deficient and can also be very sensitive to magnesium-induced diarrhea, especially during their cycle if a patient is using this for PMS, for example. All right, next up we have magnesium citrate, which is known for its gentle laxative effect, and this may be a great add-on for helping with occasional constipation. There are several supplements that have magnesium citrate blended into their formulas to help promote regular bowel movements. This is a key aspect, like we discussed, of hormone balancing, so definitely another great form to utilize, but be careful in a patient who is sensitive to magnesium-induced diarrhea. Magnesium oxide is a much stronger laxative than citrate, but it's important to note that it's less bioavailable compared to other forms, so less effective for increasing overall magnesium levels if someone is deficient. However, it'll definitely relieve constipation rapidly, but should not be used repeatedly. This is also the form commonly used for heartburn relief. Next, we have magnesium L-threonate, one of my other favorites because similar to magnesium glycinate, it has high bioavailability. It is well known for its cognitive benefits, including memory enhancement and improved cognition because of its unique ability to cross the blood-brain barrier, delivering magnesium directly to the brain cells. How cool. This also makes it great for stress, sleep, mood, therefore just making it a great way to indirectly support hormonal balance, given the significant role that stress and sleep quality play in hormone regulation. We also have others, magnesium malate, which is beneficial for boosting energy levels and supporting muscle function. We have magnesium taurate, which is known for supporting cardiovascular health, lowering blood pressure, improving insulin sensitivity, overall just making it great for those with metabolic syndrome as well. Magnesium chloride is often used topically for muscle relaxation or deeper sleep. Typically, that's what you would spray on the bottom of your feet. And last on the list, we have magnesium sulfate, also known as an Epsom salt bath, which is widely used to detox, relax, and just relieve sore muscles. As you can see, magnesium offers a lot of benefits in different forms, and there are several ways magnesium can contribute to hormone balancing, either directly or indirectly. So just wanted to include some of the most common ones that we see in formulations. As I mentioned in the beginning slides, hormone balance and sleep hygiene are interconnected. Magnesium helps with falling or staying asleep by modulating NMDA receptors, which influences circadian rhythms, and binding to GABA receptors, which promotes a calming effect. Since magnesium calms your nervous system, this also supports your HPA axis. And when the HPA axis functions well and does not produce excess of cortisol, it positively influences other hormones as well. Remember that cascade we talked about. Magnesium glycinate in particular has additional calming effects due to the amino acid glycine, which is known for its ability to calm the nervous system independently of magnesium. This is another reason why so many practitioners and patients love this formulation. Magnesium also directly supports our hormones by optimizing the action of progesterone, which is known for its calming effects on the central nervous system. Progesterone helps stabilize mood and reduce anxiety. Therefore, magnesium can be beneficial for patients dealing with disorders like PMDD, menstrual migraines, perimenopause, and more. From an estrogen standpoint, magnesium supports liver detoxification processes, promoting the healthy excretion of estrogen. This is particularly helpful for estrogen-dominant patients dealing with heavy periods, PMS symptoms, breast tenderness, fibroids, insulin resistance, endometriosis, the list. It goes on, and you'll hear us talk about estrogen dominance quite a bit throughout this presentation. But overall, it just supports everything, it seems. And speaking of PMS symptom reduction, I pulled this one out as a specific benefit to highlight because it is such a common complaint amongst many patients. Magnesium is going to help reduce PMS symptoms over time by supporting estrogen detoxification, but it also helps directly reduce them since magnesium helps relax the muscles and reduce the production of prostaglandins, especially when combined with vitamin B6, which enhances the absorption of magnesium and has similar effects leading to synergy. We'll get into more detail about vitamin B in a few slides. And it's also important to note that magnesium is crucial for vitamin D activation and functioning, which we will also discuss in further detail in just a few slides. However, like our hormones, balance is key because excessive vitamin D intake can actually lead to magnesium deficiency. So you don't want to just add supplements without considering other ramifications. Another important function of vitamin D is supporting the thyroid. Magnesium indirectly supports thyroid health by maintaining adequate vitamin D levels. More directly, vitamin D is essential for the conversion of T4 to T3, the active thyroid hormone, which is crucial for thyroid function. Magnesium also has anti-inflammatory properties which help reduce the autoimmune inflammation underlying many thyroid conditions. Due to these mechanisms, the WOMED trial found a direct correlation between magnesium levels and thyroid health. Additionally, magnesium is known for increasing insulin sensitivity, which benefits conditions like PCOS, estrogen dominance, and metabolic dysfunctions such as prediabetes or diabetes. Magnesium serves as a cofactor for several key enzymes involved in glucose metabolism and insulin signaling. In the magnesium glycinate formulation specifically, glycine is a precursor to glutathione, which supports insulin sensitivity and methylation. This further demonstrates why magnesium glycinate is a preferred option for hormone balancing. Okay, so now that we've reviewed some of the ways magnesium helps hormone balancing, let's get into specific doses. The RDA for magnesium is 400 to 420 milligrams for men, 310 to 320 milligrams for women, and the Office of Dietary Supplements recommends an upper limit of 350 milligrams per day. However, these amounts are meant to prevent deficiency, not necessarily for treatment purposes or symptom reversal. This will be a common theme that you hear me repeat when we discuss dosing. As with anything in functional medicine, dosing is going to be personalized based upon the supplement form, imbalance you're treating, side effect profile, health conditions, interactions, etc. They may be taking a medication that causes magnesium deficiency, for example, and therefore require a higher dose to not only treat the imbalance, but also make up for the fact that they are on that chronic medication. So again, just have to keep that in mind when you are personalizing recommendations. Generally, many functional practitioners are going to recommend larger doses of 500 to 1,000 milligrams per day of magnesium from various forms. And that tracks with the fact that most studies used around 600 milligrams per day from various forms as well. For magnesium glycinate specifically, the typical dose for hormone support is going to range from 100 to 400 milligrams at bedtime due to its relaxing effect. For added benefits, it can be combined with vitamin D3 and B6, as I mentioned previously, to enhance absorption. When being used for PMS specifically, certain functional medicine hormone experts recommend slightly higher doses of 300 to 450 milligrams each night, and then have the potential for increased dosing depending on severity of their symptoms about a week or so before their cycle actually begins. For constipation, we talked about adding on some magnesium citrate, for example, and this would be about 100 to 300 milligrams per day. However, just a reminder, please be very careful around their cycle if they already struggle with GI effects on their period, because if diarrhea occurs at any point, you'll obviously need to reduce the dose and follow up on symptoms. The last thing we want is an electrolyte imbalance caused by taking magnesium. Low mag could be life-threatening and lead to severe issues if left unmonitored. However, monitoring magnesium levels can be tricky. Regular serum levels are what we see most commonly tested, and these are considered normal around 1.7 to 2.2 mg per deciliter. But honestly, they're a poor predictor of overall magnesium status, since 99% of magnesium is stored inside the cells, which is why a lot of functional medicine practitioners will use specialty lab testing to order red blood cell magnesium, which is better at assessing their magnesium levels, but still not always perfectly accurate. The most practical approach is to monitor symptoms and see how you feel after starting supplementing, which is why I'm always a big fan of a simple symptom log. For some forms of magnesium and indications, patients will notice changes very quickly, such as constipation or sleep. However, other benefits may take up to 8 to 12 weeks to really become more noticeable. This is a huge counseling point for patients and just helping them manage their expectations, which will increase their overall adherence. Magnesium is generally safe, but like all supplements, it can cause adverse effects, especially as we move into higher doses or with certain forms. Diarrhea, nausea, and abdominal cramps are the most common side effects and typically seen with forms like magnesium oxide and sometimes citrate. Magnesium toxicity is rare, but it can occur, especially in individuals taking larger therapeutic doses or those who have kidney impairment. Initial symptoms may include hypotension, nausea, vomiting, facial flushing, and lethargy. And if left untreated, it can progress to muscle weakness, difficulty breathing, severe hypotension, irregular heart rate, and cardiac arrest. Oftentimes, people think anything over the counter is benign, but as a pharmacist passionate about medication safety, I just wanted to include this to remind you all to counsel your patients. And while magnesium is extremely beneficial and essential, there are certain conditions where caution is warranted. As I just mentioned in dosing, we have to be careful in our renal impairment patients since magnesium is eliminated by the kidneys and impaired renal function can increase the risk of toxicity. Magnesium is also contraindicated in neuromuscular diseases such as myasthenia gravis because these conditions can be exacerbated by magnesium since it inhibits the release of acetylcholine. Here's an overview of special populations to consider as well. For sake of time, I'm going to be brief, but it's important to note that magnesium supplementation is safe in lactation and liver disease. The last piece I want to touch on for magnesium is interactions. Of course, as a pharmacist, I can't help but pay a little extra attention to drug-supplement interactions or drug-drug interactions, supplement-supplement interactions. I love it all. The only major interaction to be aware of is with levodopa-carbidopa, Sinemet, as magnesium can reduce its bioavailability, so it's not recommended to use. There are a few moderate interactions which may result in notable interactions that could affect the efficacy or safety of either substance, and therefore it is advised to use with caution, but not necessarily prohibit. So, some examples include in certain antibiotics such as aminoglycosides, tetracyclines, and quinolones, where magnesium can increase the risk of neuromuscular weakness in aminoglycosides and reduce the absorption for tetracyclines and quinolones. With potassium-sparing diuretics, magnesium can decrease magnesium excretion, potentially increasing levels. With bisphosphonates, magnesium can reduce their absorption. With sulfonylureas, magnesium can increase their absorption and lead to an even greater risk of hypoglycemia. Not a fan for this reason. And with calcium channel blockers, magnesium may have additive effects, but evidence is conflicting. With digoxin, magnesium can reduce absorption. And lastly, with skeletal muscle relaxants, magnesium can enhance their effects, so a reduced dose may be necessary. Of course, we can't forget about how supplements interact with other supplements as well. Magnesium can interact with calcium, vitamin D, zinc, and boron. High doses of calcium can decrease magnesium absorption. And like we mentioned earlier, vitamin D enhances magnesium absorption, but excessive amounts of vitamin D can cause magnesium deficiency. High doses of zinc may reduce magnesium absorption, and boron can reduce urinary excretion of magnesium in some people. Overall, these interactions highlight the importance of updating and reviewing a patient's medication and supplement regimen thoroughly before recommending magnesium supplementation or even a particular dose. Another example of why personalized healthcare is so important It allows us to design a comprehensive supplement regimen that maximizes benefits while minimizing potential risks. Hopefully, all of this information on magnesium empowers you to utilize it with your patients struggling with hormonal imbalances. And with that, we've wrapped up our time together, and I just wanted to thank you all so much for joining this quick presentation about magnesium and how it contributes to hormone balance. Of course, if you have any questions or want to learn more about magnesium, please feel free to reach out. Thank you again for your time, and I hope this empowers you to help empower your patients with their hormonal imbalances and to use professional grade supplementation safely and effectively. Thanks again.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.